Hi guys, hi everyone. So I promised you guys I would do a live talking about belly buttons. So this live we are going to discuss everything belly button related when you have plastic surgery, whether it's lipo or a tummy tuck. Some of these things are going to be applicable to people that are having a tummy tuck, and some of the items are going to be applicable if you're having just lipo only. So let's just jump right into it. I am going to save this live and post it on YouTube when we're done here. I know this is something that a lot of people are interested in and they don't have the answers to their questions. A lot of times you guys have plastic surgery, your plastic surgeon's done an amazing job with your results and so forth, but a lot of times the majority of these plastic surgeons, and I don't care where you are, America, DR, Colombia, Brazil, Venezuela, a lot of times the plastic surgeon do not have good information to give you how to take care of your belly button if you have a complication, what should be your post-op instructions. Their assistants, whether they're doctors, MDs, or just secretaries, they also don't have information to give you when you arise with a problem and you're asking for help. That was my own personal journey, my own personal story I can give you when I had my tummy tuck. And the help that I thought I would get from my plastic surgeon, who did an amazing job with my body. However, when it came to post-op care and how to fix a complication, I did not get good information. I literally had to figure it out on my own. And now that I have figured it out on my own, I am happy to share that information with you guys, which is trial and error on my own body, what I did to heal my leaking belly button. So I'm going to be looking at my Surgery Bay feed, IG stories on Surgery Bay, where I posted these questions and you guys were giving some answers. So I'm going to read each question and then we're going to answer it. So the first question I asked was, do you get a new belly button when you're having a tummy tuck? So far, 69% said yes, and 31% said no. So the people that said yes, you are wrong. And let me explain why you are wrong. Because when you get a tummy tuck, your belly button, meaning your umbilical stalk, because when we're babies, we feed through our belly button, which is the umbilical cord, right? So when you're born and they cut your umbilical cord, what remains, our belly button, has an internal part. It's not just external, your belly button. So your belly button has what is called the umbilical stalk, and the umbilical stalk is the internal part of your umbilical cord, of your belly button, that was cut at birth. So that is attached to the muscles in your abdominal wall. So you don't get a new belly button. What is simply done is when the tummy tuck occurs and they cut all that skin, which is your fupa area, off, and now and let me stand up so I can maybe give you guys an example to look at. So when you get the tummy tuck, right, this part, your fupa, they cut it off. And this skin, as they lipo and so forth, this skin is literally lifted off the entire torso. This skin is now pulled down to down here and stitched. So this part, your belly button, if the surgeon does not make a hole in this skin, right? So they're gonna cut a hole in this skin and simply take the umbilical stalk and pop it through and then stitch around it. So it's not a new belly button you're getting. It is your same belly button that you have, that they basically reattached to the skin with stitches. So if you have an innie, like I do, or you have an outie, it's the same belly button. It's literally just simply that the flesh on your belly, your torso, they make a hole in that and just pop that umbilical stalk through and make stitches around it. So you do not get a new belly button. So you guys that said yes you do, 69% of you all so far that answered the poll, unfortunately you are wrong. My next question is, what is an umbilical stalk? Somebody answered and said, what they keep of your belly button and stitch it back in the new hole placement. And she is correct. So that is the umbilical stalk, like I just said earlier. It is what is attached to your body as a baby, what you're feeding through your umbilical cord. And that is attached to the abdominal muscles in your abdominal wall. So that's what an umbilical stalk is. Google it, guys. What are common post-op complications of the belly button after a tummy tuck? All right, so we have some answers here. And some of the answers are infection and shaping or lack of shaping. Moisture is not allowing your belly button to close. Losing a belly button. I don't have one anymore, so this round 2 I will have to get a correction. So some of the common post-op complications of your belly button after you have a tummy tuck. Now, Lipo 360, I've had 2 rounds of Lipo 360 and I've never had an issue with my belly button. The only thing is you would have to, you know, shape it with belly button training. But to say I've had a complication or an issue, no, because all they do is make a little like cut or incision just above the belly button and then stick the cannula in there and lipo you. Now with the tummy tuck, because they are pulling this entire torso skin down and making a hole in it and stitching it up, now you have this space between the skin flap and your abdominal wall or your abdominal cavity. That's the area that's filling up with fluid, and that's why they put the drain to help get some of that fluid out. That's a whole nother topic for another live, right? But some of the complications that you have, for me, the most common one that I had was a leaking belly button. So how I knew it was leaking and what I did to fix it. Let's talk about that. About 5 weeks after my tummy tuck, what I would do every day when I clean my belly button and clean my tummy tuck incision, I would take a little piece of gauze, the netted cotton gauze, roll it up like a little ball, dust my belly button with Tecasol powder, the antibiotic powder, stick the gauze in there and put a little piece of tape over it. So this is what I did for the first like 2 months from my tummy tuck. At 5 weeks post-op, the gauze inside my belly button, I started noticing that it had a little yellow stuff on it. So the little yellow stuff is like fluid. It wasn't pus, it wasn't smelly, it wasn't an infection. I know you guys are quick to say everything is an infection. It was not. But the leaking belly button is usually because there's a splitting stitch. So the body is rejecting one of these stitches, and that is what causing this fluid to start. Okay, so my plastic surgeon, his answer was Tecasol, that's it. He didn't give me any other information. Every time I would send him a video, send him pictures, doctor, it's not getting any better. It's getting worse. It's getting from the leaking fluid to now the inside, the flesh of the belly button was turning pink and then raw red, and it was like a little wound in there. It was getting worse. I did what everybody love to say in these like surgery groups and whatever. They love to tell you, oh, don't wear your faja, let the wound breathe. Listen, that's bullshit. The wound does not need to breathe, and the mere fact that you take your faja off after having a tummy tuck and you're 5-6 weeks post-op, 4 weeks post-op, you are ridiculously swollen. At least some of us are. And I did all of that. Took off the faja for a whole week. That didn't work. Let it breathe. That didn't work. And I was crazy swollen by not being in my faja. So trial and error. What I did was I started researching how people that pierce their belly button, what they did to heal it after it got infected. So this is the trick that I used, and this healed my belly button fully within 7 to 10 days. So get your pen, get your paper. I'm dropping a gem here for free because I charge for this. So it's a 3-step process. First, you're gonna get some saline and you're going to clean the belly button with the saline. I love to use McNeil wound wash. This is something you get in Walmart, or you can probably get it in the local pharmacy, Walgreens, CVS, whoever, Rite Aid. But saline, because the salt in the saline is what is going to start drying up that liquid, that yellow fluid that was coming out. And I think it was maybe after using it for like 2 or 3 times, and I did this twice a day. Literally, I saw a difference. Like the fluid started getting slower and slower until it stopped. So saline to clean out the inside of the belly button. You can moisten like a cotton ball and stick it in your belly button for, let's say, 2 minutes. Let it sit in there. Then you're going to take some Tecasol, the antibiotic powder, and dust inside there because you want the belly button to remain dry. having a wound remain wet and moist is not cohesive to healing. It will delay your healing. So people that like to use Bactine, Neosporin, Aquaphor, Vaseline, all this bullshit, your wound, yes, it will heal, but it will take a lot longer than if you were to keep the area dry without any kind of moisture. And that's why I love the Tecasol powder, because it's not only keeping it dry, but it's also antibiotic. So it's going to kill any kind of germs that's, you know, in that area. And remember, moisture is a breeding ground for germs, right? When my belly button started getting that raw spot, I bought some Medihoney. It's on Amazon. It's, if you guys go and click on my Surgery Bay Instagram, you click on the Linktree profile, the URL, you will see my Amazon store. It is right there, Medihoney, with all these other gems that I have in there for you to purchase for your own recovery. And I would put the Tecasol and a little bit of the Medihoney. A little bit goes a long way. And put a little gauze in there, cover with some tape, back in my faja. I did that twice a day, and my belly button went from being raw, like a raw wound, to totally healed, meaning the little rawness healed up and my regular complexion of my skin started coming back. It took about 10 days. And that's because mine's advanced from just leaking to now, you know, getting that raw wet wound. So that is the most common post-op complication. You guys that are saying, like this person said, I don't have a belly button, I honestly don't know what she did personally as to why she don't have a belly button anymore. But if you have a tummy tuck and you do not do any kind of belly button training, remember that when you get into this nice and tight faja, because you have to wear your faja tight to mold and shape your body and give you that curvaceous figure, right? Your skin is getting squished like this. So your skin is going to be like a line. Your belly button is going to turn into a line. It's not going to be nice and circular like a regular belly button. Or this part of your belly here, right here, some people, it gets into like a line and they literally have like a long line crease like in their skin. So the most important part of not having that line in your body, not having that line for a belly button, or that coin slot as they call it, is you have to train your belly button. But you don't want to do it too early, because when you get a tummy tuck, the belly button is the thing that takes the longest to heal, right? So I always advise my clients to start belly button training about a month post-op from your tummy tuck, after those incisions have healed, because around that time frame, 4, 5 weeks, 6 weeks, if you are going to have a splitting stitch, that's when you're going to see that the belly button is turning into a line, right? So that's when you want to start, or you're going to have a post-op complication, I'm sorry, around that time frame. Sorry, I was looking at my WhatsApp messages. No, sorry. So that's she doesn't have a belly button. Why she doesn't have one, I don't know. Maybe she didn't belly button train. Maybe she had an issue and it was a leaking belly button and she did nothing except wait for the wound to heal, and then it healed with nothing. So she's saying that she now has to go and do a revision surgery for them to create a belly button, another belly button for her, which is find that umbilical stalk that's now inside her body again, or above the abdominal cavity, make a hole in the skin and pull it back through and stitch it around. So it's not that her belly button disappeared, she doesn't have a belly button, they have to create one. No, it's that the umbilical stalk, the belly button, is now back under the skin, and they have to make a cut in her skin, pull it through and stitch it again. Next question. When do you start belly button training? I just answered that, right? So usually 30 days, 1 month post-op is when I recommend to my clients to start your belly button training if you don't have complications from a tummy tuck. Lipo 360, that little stitch that they put there, that's where they stick the cannula, like I told you guys, and do your lipo. I would say within 1 to 2 weeks, once that stitch is healed and you cut out any kind of little pieces of suture that you may have sticking out there, you can start belly button training for Lipo 360. But at least with tummy tuck, give it a month or more before you start doing the belly button training. Now, what are commonly used to train the belly button? So me personally, this is what I did. Other people do different things. I know some of these surgery supply places, they sell that silicone air plug, I think for like $30. People do a marble. People do a cotton ball. What I did personally and what I recommend to my clients is a foam air plug. So those regular earplugs, Walmart sells them. A box of 10 is like $2.50. And you don't even need 10 unless they get dirty and you throw them out, right? But that's what I did. And why I like the foam earplug and I don't like hard things like the silicone earplug or a marble is because that area is so tender that you don't want the roughness and the hardness of those materials to make you get like a raw wound in your belly button. I don't know about the new silicone earplugs, silicone belly button plugs that some of these surgery supply people are selling. But before in the past, I've seen some people buy them and use them, and their belly button was so huge, like a crater. Like, that did not look cute. So why I like the foam earplug is because it's small and you have a cute belly button. So let me show you all mine. So that's my belly button. It's, for me, nice and cute and small. I don't like the big crater looking belly button. So that's why I recommend the foam earplug. It's soft. It's not going to hurt your skin. And it gives you a nice sized belly button. Sorry, that's one of the roadside vendors here. This is what I love about the DR. Like, you get so much fresh food here. Like, he is with his little cart. What does he have? Let me tell you all. He has bananas, plantains, tomatoes, celery, like all of that. So they be going around with their little cart in the neighborhood making noise so people know that they're outside, and you can just come out and buy whatever you want. So when I tell you guys you get fresh food here, you get fresh food here. Anywho, so the foam earplug. So the process that I would say to do, the foam earplug, first of all, is too long. So you have to take some scissors and cut it a little shorter. Wrap a little gauze around it. Dust your belly button with the Tekasol. Stick that in there. Put a little piece of tape over it to hold it in place. And if you are wearing your faja, you want to have this foam earplug in there. And you want to have this foam earplug in there. If you're wearing your faja 24/7, the foam earplug must be in there 24/7. Me personally, after my tummy tuck, I wore my faja for 1 year full, 1 full year, to get that shape and to get that, you know, that molding of that body that I wanted. And that foam earplug would be in there 24/7. I would only take it out when I'm going to go shower. I don't even think I took it out when I had sex. To be very honest, I think I only took it out to shower. And then it was back in there, you know, with the little tape on it. So that's what I did. $2.50, you get 10 earplugs in Walmart. And you would use one foam earplug for months before you need to change it to a new one, to be honest. All right. So those were all the questions that I asked. People here were saying that they use marble to do the earplug, cotton ball, marble, and the earplug. So for me personally, I told you guys earlier why I don't like the marble or the silicone belly button. And I mean, to be honest with you, not to knock anybody's hustle, you know, people that are selling that silicone belly button plug for $30, more power to you. But at least I can tell you guys a more economical way, and you will get nice results, which is the foam earplug, $2.50 in Walmart for a box of 10, or any truck stop or wherever, you know, they'll be selling these things because that's something that, you know, workers use, you know, construction workers, whatever. So you might find it in other places, probably even cheaper too. So that's it, guys. That is talking all about belly buttons, all about tummy tuck, lipo, if you had any of those procedures, and what is going on with your belly button. So I am going to end this live and I am going to post it on YouTube. If you guys don't know what my YouTube is, my brand is Surgery Bay. So I'm pretty sure if you type in Google Surgery Bay YouTube, you will find my channel, you will find different videos come up. Just click on it. I'm sure you guys know how to navigate YouTube, which is when you find a video to click on the person's name, and then you can find their profile and you can follow them and so forth. So I'm going to post this up there. Go to Surgery Bay, not this is, you know, Surgery Bay DR, but Surgery Bay, and let me know if you guys have any other questions. Answer the stuff that I have in the IG stories. the video that I posted talking about this lady's belly button, it's on Surgery Bay. That was to shock and awe you guys and to get some responses from people to start being more, what is the word I'm looking for? To have more interaction with my followers. So you guys did answer in there and said that that's not her belly button, that's a crease, that's a tattoo or whatever. But it worked. I got you guys thinking, I got you guys talking, I got you guys, you know, what is it? Interacting with the forum. So I don't believe that's her belly button either, because it was like literally under here. But I have seen where some surgeons, they have placed people's new belly button in a bad placement, like it was not on their waist like it should be, right? Because your belly button should be symmetrical with your waist. So in her case, I don't believe that's her belly button, because there's no way you can stretch the umbilical cord all the way from down here by the waist to under the breast. Like that's the sternum, that's the, you know. But again, it was supposed to be a video to shock and awe and make you guys interact, and you guys did. So I will say goodbye to you guys now, and let's think about another topic we can do another video on and post up, you know, so you guys can get some gems. If you guys do not follow my YouTube, you have never looked at any videos I've done on YouTube, you are missing out a lot, because a lot of things that you guys have questions for, the answers are in my YouTube. You don't need to look at the video, you just need to listen. So put your headphones in, go do some housework, go clean you guys' house, and just listen. There is a lot of gems on there where you don't even have to pay somebody to coordinate your surgery for you, because all the information is there for you. You just have to do your research. Research is what? Reading, listening, looking, not just watching videos and not reading captions, things like that. So go share my YouTube, go like, go follow, go subscribe. I think I want to start doing lives on YouTube so that the video automatically posts on there, opposed to me having to download it here on my phone and then post on YouTube. So if you have questions that you want answered about a specific topic with plastic surgery, send me a message. I will talk to you guys later.